Is your vaginal discharge trying to tell you something, or is it just business as usual? Let's clear up the confusion once and for all. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Today, we're talking about vaginal discharge, what's normal, what's not, and when it's time to pay closer attention. First, let's bust a myth. Discharge isn't dirty, and it's not something to be ashamed of. In fact, it's your vagina's way of naturally cleaning itself, a built-in wellness system that protects you from infections and keeps everything in balance. Think of discharge like sweat. It changes depending on what's happening in your body. I once had a patient, let's call her Lisa, who came in thinking something was horribly wrong. She noticed a slippery, egg white type of discharge mid-month and assumed it was an infection. Turns out, Lisa was ovulating. Totally normal. Her body was just doing its thing. Here's the scoop on normal discharge. It's usually clear or milky, can be thin or slightly sticky, and may have a mild scent. Your hormones, menstrual cycle, age, even your stress levels can all influence the way it looks or feels. Teenagers, those on birth control, and women approaching menopause may all notice different textures or amounts. It's all part of the hormonal roller coaster. So what counts as abnormal? It's all about knowing what's typical for you and spotting changes. Some red flags to look out for include a sudden shift in color, especially green, gray, or yellow, chunky or cottage cheese-like texture, strong, fishy, or foul odor, itching, burning, or pain during urination, a dramatic increase in volume. Especially if it's persistent, these changes can point to several different issues. For instance, a yeast infection often brings thick white discharge and intense itching. Bacterial vaginosis usually causes a gray discharge with that unmistakable fishy smell. Sexually transmitted infections like chlamydia or gonorrhea may trigger yellow or green discharge and pain while peeing. And yes, in rare cases, discharge that's brown, red, or oddly persistent could be linked to cervical or uterine conditions, including cancer. But before you panic, remember, many of these symptoms overlap with far less serious issues. The bottom line? You know your body best. If something feels off, don't self-diagnose with a Google search. Get checked. Now let's talk home care and prevention. Here's how to keep your vaginal flora happy and healthy. Use warm water and mild, unscented soap to cleanse, no douching or harsh scrubbing. Say no to scented washes, bubble baths, and wipes. They can mess with your natural pH. Opt for breathable cotton underwear and avoid super tight pants when you can. Always wipe front to back after using the bathroom. Yes, it's simple, but so important. Get to know your personal baseline. Track what's normal for you in a journal or an app. Remember that variation is part of the normal cycle. But if you ever notice discharge that is suddenly bloody, accompanied by pelvic pain, or truly smells off, don't wait. Trust your instincts and talk to a professional. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade. Doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. Like this video? Hit like and follow for more doctor-approved info you can trust from UB Health.